Hi there,
Hi.
my name is Amanda. I'm going to be performing a cardiac exam assessment on you and a peripheral vascular exam. So I closed the curtain to maintain your privacy, and I'm going to wash my hands here. First thing I'm going to assess is your jugular venous pulsation. So I'm going to have you look that way, and I see you have nice pulsation. I'm going to feel your carotid artery. Good, and I would assess that on the other side as well, making sure that they were even with the rate and rhythm. I'm going to listen to your carotid artery with the bell of my stethoscope in 3 areas. And then of course I would repeat this on the other side, ensuring that there is no bruise, which there isn't. I would inspect your upper extremities here, and I'm just going to do one side. We would obviously do the other side. The color is nice and pink and dry. Your hair is evenly distributed. Your fingernails are regular and smooth. Cap refills less than 3 seconds, which is normal. Less than 2 seconds, forgive me. And then I would check your radial pulse. Checking for the pulsation, I would compare it to the other side, making sure that they were nice and even. Check your brachial pulse as well, once again comparing it to the other side. And then I would check your epitropical nodes by reaching around, and I don't palpate any nodes in between the bicep and the tricep of the arm, which is normal. So I'm going to have you lean forward for me, and I'm going to listen to the base of your heart. And again, I would repeat this on the other side as well, noting that there's no S3 or S4 sounds. Go ahead and lay back, and I'm going to lay it all the way flat so I can check your precordium, which is in between the 4th and 5th intercostal space. I'm going to uncover you, making sure there's no heaves or lifts. It's lateral to the midclavicular line on the left side. I would palpate with one finger pad, making sure I can feel the pulsation. And then I'm going to listen to you as well. I'm going to listen to the aortic first. I would listen for 1 full minute to each areas of the heart. And the aortic is located in the 2nd intercostal space, followed by the pulmonic, which is on the left side on the 2nd intercostal space. Erb's point, which is the 3rd intercostal space on the left-hand side. Tricuspid, which is the 5th intercostal space on the left-hand side. And then followed by the mitral, which is the 5th intercostal space on the clavicular left-hand side. And then I'm going to have you turn on your left lateral side, please. And I'm just going to listen to the apex of the heart, assuring that S1 is louder than S2 and that there's no S3 or S4 noted. And you can roll back. And then I'm going to cover you up, and then I'm going to move to the lower half. I'm going to uncover your legs. While I'm uncovering you, I'm noticing that your skin is nice and pink and dry. The hair is evenly distributed. Your toes are smooth and regular. Your cap refills less than 2 seconds. Looking in between your toes, they're nice and smooth. There's no fungus or anything growing. There's no varicose veins to note. I'm going to check your pulses and your lower half, so I'm going to have you bend your knee up and kind of lay it out to the side like a frog. And I would check in your groin for your femoral pulse, and I would compare all of this on the other side as well. I'm going to check your popliteal, which is behind your knee, your posterior tibial behind the ankle, and then your dorsalis pedis, which is the top of your foot. I would feel for the temperature, which is nice and warm. There's no edema to palpate at all. And I am done with my assessment. Thank you.
You're welcome.